Well, hi everyone, this is Dr. Schroder with this week's video introduction to week number 8, and actually our final week of our course in the Principles of Patient and Staff Education. So we're pretty much just about to have the entire class wrapped up. By the time you read this or see this, you will probably be submitting your final assignment of the class, and we'll have finished up your week 7 discussion question. This week, the focus was to talk about, well, besides doing your QSIN simulation, we talked in QSIN this week. QSIN, the quality safety of education in nursing, is important standards. We've been talking about this actually for the last couple of weeks. And so this week was to do a literature search and then cross-reference quality and safety back to nursing. And so, in other words, the idea here is that, understanding what does our evidence-based practice say about the quality of education, the quality of the nursing interventions that we provide, and how it all relates back to safety. And this is something that, quite frankly, is dynamic and changing. I was just made aware this week, as a matter of fact, that, well, I'm sure that we'll all remember and all know how we've always considered and always called pain the fifth vital sign. And so part of quality and safety in education and nurses was understanding the importance of pain assessment and the importance of managing and controlling pain. And of course, with the opiate epidemic, the standards here are changing a little bit. So we're kind of getting away from this concept of pain being the fifth vital sign and that saying that pain has to be controlled to a certain level and to call that quality of care. Now the standard is going to be, and the standard in the assessments and patient satisfaction and accreditation assessments is going to be, has pain been discussed? Has pain management been discussed? Pain education been provided, as opposed to are we controlling your pain adequately? And that seems like a fine, subtle little difference, but actually it is a rather large difference when we're talking about the overall scheme of things, our attitude towards pain management. For the last several years, we've been operating under the concept that pain has been historically underreported and poorly managed. And so we've gone over the deep end a little bit in trying to over-medicate for pain. And that's led to the opiate crisis. And so now we're really kind of sort of pulling back from that a bit. And so this is something that has to be reflected all through patient education, through our standards, and requires quite a bit of reorienting and re-educating nurses on what the pain standards are and how do we deal with that, how do we handle that. So anyway, so that's once again a very good discussion this week, and I will be reviewing and grading your simulation papers. I'm posting this on Sunday afternoon, so well, this is the final week of class. And so everything is going to have to be graded by come this Friday. So the discussion questions from week 7 and the grading from those papers should all be completed. I'm guessing probably by Thursday afternoon, Thursday evening will be the latest that they will be done. The discussion questions in question number, or week number 8, we focus on a topic or revisit a topic that we've also been discussing all along, which is leadership and how do nurse educators work within health education systems or work within health systems. What roles do people play, and what roles is it that the nurse educator takes within these systems, and how can we really serve to be or work to be the most effective in our roles and in the roles that we've served. So that's going to be the week 8. And remember, this is the final week of class, so the initial discussion questions are due by Wednesday as always, but remember, you only have until Friday to complete your follow-up postings. Because of that, because it is a shortened week, I do not require you to, for full credit, if you do your postings on the same day. In other words, if you do your 2 follow-up post to peers on the same day, you can still get full credit. we're kind of sort of shorting you a day of discussion, so that seems like it's kind of fair. You should still participate at least twice during the week. But if at least you're participating twice during the week, you'll be able to receive full credit, assuming that all of the criteria is met. So I think that's about it. It has been a wonderful class. It has been excellent being your instructor. One last task, remember that there is a student satisfaction survey and a student class and a course survey. Please ask you to fill that out. Your feedback is important. Uh, the feedback helps us to determine the best curriculum, helps us to make sure that we're providing what we need to and meeting, doing what we need to do to meet our students' needs. And it's also important for me personally because that's how, it's those surveys are one of the key indicators to make sure that I get to continue to teach for Sacred Heart University. And so I trust and I hope that it's been a positive classroom experience for you. At any rate, your feedback is highly appreciated, and I thank you for taking the time out to go ahead and complete those. So I wish you all well as you continue on in your educational journey. Of course, as you have any questions, please let me know. And I wish you well. I bid you adieu, and I look forward to seeing you in discussion forums.